In this presentation, I'm going to discuss budget and managing fiscal resources. All material discussed comes from the textbook Effective Leadership in Management in Nursing by Eleanor Sullivan, unless otherwise noted. What is a budget? Budgeting is the process of planning and working to meet or exceeding the goals of the plan. A budget is a quantitative statement, usually in monetary terms, of the plans and expectations of a defined area over a specified period of time. The managers within a health system are responsible for finding ways to budget. Cost centers are used to enable the manager to predict cost of staffing and supplies. A cost center, by definition, is the smallest unit within an organization that costs are accumulated. Revenue centers are for generating revenue to make the purchases within the budget. The profit centers are responsible for handling the generated revenue and managing the costs to show a profit for the department. Finally, the investment centers are responsible for managing costs of assets and the purchase of capital equipment. These individual groups work to produce a budget that is economically feasible. There are three methods that are commonly used to develop an overall budget. Incremental budget. This is a method of forecasting expenses in a line-by-line spreadsheet. Often the line items are divided into salary and non-salary categories, and they can be carried over from the prior year or projected based on costs at the time of development. This is a simple method of developing a budget, although it has a drawback of promoting the manager to spend on the budget to be awarded the same or more for the following year, not necessarily base all purchases on actual need at the time. Zero-based budget. This method is more time-consuming than incremental budgeting. It requires the manager to develop a budget with line items based on the need and justify each need like it has not been done in previous years. There is no carryover from year to year. Each budget is submitted like it is the first time it was ever done. There is no automatic increase due to inflation. Fixed and variable budgets. These budgets are categorized as fixed or variable. The fixed budget is produced with no expectation of change throughout the budget year. Examples would be an increase or decrease in patient volume. In contrast, variable budgets are developed with a philosophy that adjustments may be made throughout the year to accommodate the changes. The operating budget is the annual budget of operation. It is how the healthcare system clearly states what the expected revenues and expenses are for the upcoming year. The revenue budget is a representation of the patient care income that will be received. This is based on the prior year's reimbursement from insurance companies. These rates often do not correlate with the actual billed amount to the patient due to discounts given to the insurance companies for bundled payments or preset negotiated rates. Medicare is the driving force for how insurance carriers are billed. The expense budget is specific to the patient care objectives and the activity parameters for the nursing unit. They contain salary and non-salary items. The expense budget should take into consideration all expenditures and include projections for the following year if available. The salary budget is the projected cost to the center for personnel within the budgeting period. This budget can be affected by staffing shortages, shift differential, and bonuses. The supply and non-salary budget identifies the supplies needed for patients and to operate the unit. These items should be reviewed and updated each budget to identify expense patterns. Maintenance agreements and rental fees should also be included in the section of this budget. The capital budget is a vital part of the overall budget. It enables the health system to identify future goals and develop a plan to fiscally achieve them. The manager plays a role in prioritizing the needs for the unit and providing feedback to the organization regarding vendors utilized within the health system. It is important to understand the budget is a projection for the year. There are changes in purchasing needs and prices associated with the need. The changes are identified as variances. The variances are divided into salary and non-salary. The salary variance relate to the personnel within the unit. Staff can have a huge impact on the budget. High turnover or unexpected unit closure can increase or decrease the budget projection, causing a variance. Non-salary variances can develop the same changes in the budget. If patient volume increases or decreases, there will be less or more demand for supplies to support the care provided. Position control is a tool used to approximate the projected budget and the variance. This tool identifies how many FTEs are designated for each unit. The manager can quickly look at this and see how many FTEs and budget and look at the schedule for variances. If there are employees out on maternity leave, there will be a temporary decrease in FTEs and an increase in PRN and part-time staff. This is important for the manager to understand when budgeting for the staff within the unit. Staff can acutely affect the organization's finances, making accurate patient care documentation very important. Misuse of sick time, excessive overtime or turnover, and wasteful use of resources can result in negative variance. The manager plays a key role in explaining the unit's goals, the organization's financial goals, and how each individual is responsible for helping the organization meet those goals. During the 1980s, there was a significant nursing shortage and high turnover at hospitals. Nurse leaders observed that some hospitals were better able to retain nurses and fill vacancies compared with similar hospitals in the same labor markets. A study by the American Academy of Nursing identified 41 hospitals at that time that acted as magnets for nurses because of their more supportive work environments. Here is a link to the website about magnet designation. Magnet hospitals provide the highest standard of care for patients, business growth and financial success, and staff who feel motivated and valued. The Lean Initiative is an initiative to improve patient safety and financial performance. Many healthcare organizations have implemented quality initiatives such as the Lean process improvement. This may be because empirical effectiveness of Lean in reducing lead times, improving space utilization, increasing throughput, improving quality, and increasing financial performance.
Going up most everywhere else. At Virginia Mason Hospital in Seattle, they're coming down by driving out waste.
And this is one of the reasons why healthcare has become unaffordable in the United States, is that we are wasting time and we're wasting valuable medical assets.
Hi, Mrs. Lauderdale.
The hospital wasted no time treating Beth Lauderdale. She was getting physical therapy for severe back pain just 2 hours after she phoned in.
I called at 8:30 and they said they had a 10:20 appointment.
She didn't get an expensive MRI or have a long wait to see a specialist. A big change from the way things used to be.
Well, 5 years ago, a person might wait a week or two for an appointment, and then they might see several docs. They might see a primary care physician. They might get an MRI.
It's the way things are still done in too much of America's healthcare system, says Senator Max Baucus, a congressional leader in healthcare reform.
We in America pay for hospitals and doctors on the basis of volume, quantity. It is the more tests ordered, the more procedures performed, the more the doctor and the hospital will get reimbursed.
Virginia Mason has changed the way it practices medicine based on an unlikely model, the way Toyota builds cars.
At the end of the day, the Toyota production system is really all about the customer, for us, the patient.
Virginia Mason CEO Dr. Gary Kaplan takes staff to Toyota's factories in Japan every year and practices what the car maker preaches. Just as the automaker's executives spend part of each day on the factory floor, Kaplan tours the hospital daily, looking for problems and solutions. Everyone is encouraged to look for changes to make work more efficient. Nurses developed ways to spend most of their time with patients instead of at the nursing station.
They're using computers on wheels, what we call cows, computers on wheels.
At a meeting each week, teams show how they've improved productivity using what Toyota calls rapid process improvement workshops. In their 4-day workshop, with the help of a home video camera, the staff of one clinic acted out what happens to a new patient. They came up with 10 things they would start doing differently immediately. Virginia Mason reached out to area employers like Costco and asked them what they needed most from hospital visits.
I care about quick treatment, immediate appointments, the right treatment at the acute time.
So, at Virginia Mason's back clinic, there were dramatic changes.
I see that you've cut the time of treatment from 66 days to 12 days on average?
Yes.
Well, these efficiencies lower patient bills. The hospital figures it saves money, too. At least $11 million so far. Well, Virginia Mason doesn't make cars. It is heading down a road that may lead to America's healthcare future. John Blackstone, CBS News, Seattle.
Budgeting and fiscal management can be a daunting task. Becoming familiar with the different budget styles used along with understanding the effects of salary and non-salary budget items can help make the development of a budget easier and more concise. I hope this gave you some insight on this process.